that you mentioned. Again, the growth that the company is targeting at the size is really astounding. And I would love to dive a bit deeper into, from what specific areas you're seeing the largest growth, and where is kind of Thermofisher doubling down, and also more than just the business divisions, what part of the value chain is Thermo going to be targeting in an increased scale in the coming years? So if you imagine, you sell many different machines and equipment across your different businesses, and growth can come from sales, from ongoing services, and also from data management services as well, all related to those machines. So how does Thermo position itself now and ideally in the future when it comes to growth from business areas as well as across the value chain?
Sure. I don't know. Do one of you guys want to address that?
I can speak for my business. I think it's quite interesting, and maybe somebody else can complement with kind of their part of the business. As I mentioned, I work within the chemical part of the business, chemical analysis, and we're actually looking at how we can change the way we work. Almost changing the mindsets of customers. And Mustafa, you kind of mentioned it, moving more into subscription-based products rather than today we're predominantly, one-off instruments. And we're looking at going down more of a kind of digital data as a service model. We're actually putting together a kind of a new financial model because we believe this is the future. One of a prime example of a massive project that we're working on at the moment around dosimetry services. We're moving from a passive to active, so real-time readings of, if you have, what's your level of radiation. And what we're looking at is almost on your phone, you can look at an application and see what's your current level of radiation exposure. And that will be based on like a monthly subscription package that we're looking to do. Another project we're working on with our safety and security environment is about data and fleet management. Some of our customers have 400 instruments, and you can imagine, right? Imagine you have 400 phones and you have to manually go on each phone and do a software update. We're looking at doing remote software updates for hundreds of instruments at the same time. And again, that will be on a subscription-based product. So that's what's going on within my business and how we're looking at getting that that growth in the future.
How I think about the question is high level, how the organization is looking at growth, and this is personally, like I'm not speaking on behalf of the company, but what I've experienced is what we're doing very well, and a lot of focus is going into is how can we build workflows. And by workflows, I mean how can we make it easier for other organizations or our customers to understand how our value proposition for the different businesses that we have fits together. So, for example, I think the video is a great example on how everything or a lot of the services, instruments, and things that we do are completely aligned with the COVID workflow. And if we start thinking about it that way, especially for strategic accounts, and most recently, what I was able to see a slide for pharma organizations, it starts making a lot more sense for customers to approach us, and the customer experience, if we think about it that from the customer point of view, is almost seamlessly, because it's very easy for them to understand what we are about and how we can add value. The challenge there is how we do that internally, being such a big organization. But I think how it's structured and how the kind of commercial team is looking at it will be very beneficial for the customer, more importantly, but for us to unravel the full potential of the organization. I hope that responds to the question, Mustafa.
Absolutely, yeah. I definitely resonate with the ideas that moving towards a kind of high-level workflow approach as well as digital subscription-based approaches make a lot of sense for a company like Thermo. But that's great. Thank you so much for your responses. We'd love to move on to the next question, and I don't want to steal the spotlight as well. So we have another question as well from Niyati. Niyati, I'd love to encourage you to open up your mic and ask your question live if you'd like to. Are you there?
Yeah, thanks so much, Mustafa. And
Hey, Niyati, you're a bit soft, at least for me. Could you speak up or try to increase your volume?
hi, Mustafa. Am I audible?
Yes.
Oh, awesome. I was wondering, hi Brian, thank you so much for the wonderful session and all your insights, and Thermofisher is an amazing company. I just wanted to ask you a question about the PCR tests you have recently mentioned in your presentation. A lot of PCR tests are primarily dependent on the presence of antigen in the patient's body, right? So my question to you is that there can be a lot of other viruses that can be present in a person, and that could lead to a false negative for COVID. So what are your thoughts on the accuracy of the PCR tests and the other antibody tests that are present in the market at the moment? Thank you.
Yeah, thanks for the question, Niyati. And it is, a great question and very topical, because I mean we've certainly seen over the last sort of 2 months a real explosion of PCR tests, and now it's starting with antibody tests as well coming onto the market and receiving emergency use authorization from the regulatory bodies, and it is, it certainly is a hot topic within the industry around the accuracy and reliability of some of these tests. I mean, as for, I'm not an expert in PCR, so I'm probably not the best person to discuss the detail around, the which tests are better than others and the risk of false negatives and so on. But what I can say from sort of a Thermofisher perspective, I know that when the company began to, look at the next step and getting an antibody test to market, that was something that was very much front of mind, and a task force was put in place to address the question, and that was ultimately why the company decided to go to market with an antibody test in conjunction with Uchi Diagnostics and with the Mayo Clinic as partners. That after that kind of thorough assessment, that was what they felt would be the best way to do this, and the way that would bring to market a test that we could stand over and that would be most reliable. But as for kind of the wider testing marketplace at the moment, COVID testing marketplace, I would say, I'm probably don't have the expertise to comment on, what's happening in relation to sort of some of the issues that have been seen with certain diagnostics.
So Brian, if I could follow up on this discussion around testing with one that I had around market access. So as you're aware, there's always a socioeconomic, ethical discussion around market access when it comes to the availability and even the pricing of testing equipment, both for PCR and antibody. How does Thermo approach that discussion, and who does it supply? How does it prioritize? Could you speak a little bit about that?
Yeah, sure. So yeah, it's again a continuous discussion within the company, and If I think of our diagnostics business, we have well-established markets in, let's say, the US, Western Europe in particular, and then a couple of countries in Asia where we have kind of well-established and well-defined routes to market. And those routes to market can vary depending on the specific assay we're talking about. So we go to market direct quite a bit in US, Europe, and some of the more developed markets in Asia. But we do also have certain assays that we go through either licensing to some other diagnostic companies, or where we OEM and work with a local partner, particularly in APAC. And that decision very much varies on, the specific market in question. And, there are, cultural considerations to be taken into account, particularly in some Asian markets around, customer habits there and preferences for dealing with, international versus local providers. And then there are also, factors to be considered around market, actual getting regulatory clearance. And that's often the biggest hurdle in these markets, is that getting regulatory clearance for these diagnostics can take years in some instances. So that's often the biggest barrier. And again, in some countries, that pathway is a little smoother when there is a local partner involved. So, there's no kind of one size fits all approach. For the same assay, we could be going direct in one region, like licensing in another sense from a commercial perspective, and what the local marketplace looks like in terms of the capability of partners. And obviously when we go, the OEM or licensing route, then, pricing is out of our control. That's something that's dictated by the local partner. They set the local market price. But yeah, we obviously control that in the markets where we go direct to a certain degree. But it is also, controlled to a large extent by reimbursement in countries, and certainly the majority of the developed markets, there is fairly well established reimbursement guidelines which dictate what price the health system in that country will pay for a certain assay. And again, that varies from country to country. Every health system is different in terms of the proportion of the system that is under government control versus private providers. But again, pricing, I think if you look at sort of the wider trends in the IVD market over the last number of years, while the number of tests coming to the market is increasing and there are new tests becoming available, downward pricing pressure is a continuous trend in recent times. And we've seen that in most developed countries, healthcare systems coming under strain and governments really putting pressure to get kind of value-based outcomes, and part of that has led to downward pricing pressure on diagnostics.
Thank you, Brian. Could I ask you to briefly explain the difference between the couple of routes to markets that you mentioned? You mentioned direct versus licensing. Could you just expand on what you mean by those for the participants on the call?
Yeah, sure. So when we talk about going direct to market, we're talking about taking our assay and going through the regulatory hurdles in that market. And that's usually something we'll do ourselves if we're going direct to market. So we will engage with the regulatory authority, whether it's the FDA in the US or the equivalent in any other country. As I say, that process, it varies by country, but you're often talking a couple of years potentially to clear all the hurdles. And again, it depends on, some countries, will take their lead from the US FDA, for example. So if you've already achieved regulatory clearance there, it can make regulatory clearance in other countries a little more straightforward. But in markets where we go direct, we go through that process ourselves. And then once we have regulatory clearance, we will, go through the process of engaging with the local providers, establishing, reimbursement if that is something that we need to do. And then that assay will be carried by our local commercial team. They'll engage with the local key opinion leaders to kind of generate awareness, and we have our own sort of sales and marketing force that bring that to market. Whereas in countries where we license, we're effectively piggybacking on the presence that maybe some of the other large diagnostic companies have, and we have various different products licensed to the likes of Roche, Abbott, Beckman Coulter, and others who basically pay us a royalty, and so they use our assays. They can often brand the assay under their own branding, but they will pay us a royalty of whatever amount for each one of those assays that they sell in a given market. So it's just another option, and that's something that we do quite a bit with PCT, with procalcitonin. That was a route to market that was chosen in order to really accelerate adoption, which it did quite effectively. So yeah, that's another route, and then I guess the other kind of route to market is OEM or contract manufacturing, and that's slightly different again, but that kind of gives us access to another piece of the value chain where we are producing the assay, bringing together the raw materials and producing the assay for a third-party diagnostics company, and it allows us to participate and have a piece of the value chain in a certain market without being directly involved on the ground.
Excellent. Thank you, Brian, for the detailed description. Very helpful. I know we're just at time now. Do you have a bit of time to continue? I see one more question on the chat.
Yeah, I think we should be okay. I'll see. I think Betty and Antonia are still on the call as well.
Yeah.
Right. And I see a question from Ruchi. So Ruchi, do you want to ask yourself, or do you prefer I take it? Okay. So Ruchi on the chat asks, how has the supply chain been affected for both COVID-19 diagnostics and other products because of the pandemic?
I don't know, Fede or Antonia, do you want to give a perspective on that?
Yeah. So it's been definitely more challenging. I can speak from the specialty chemicals point of view. It has really. I think at the beginning everybody understood that it was going to be difficult, and moving things around the world had its challenges. Now that we are in a bit of a state of kind of trying to get back to normality sort of scenario, people or customers, internal and external, I get a bit less patient to call it somehow, but at the end it's about managing expectations and being completely transparent and truthful to the reality. Definitely it's been I've been involved in quite let's call it difficult conversations with customers, because in certain cases it's especially internally, we need to deliver these tests, and if we don't have the chemicals, we're not going to be able to do it. But I think once the supply chain is established and we manage to create a bit of buffer in terms of the supply that we're trying to get, it becomes slightly easier. And basically the strategy is having backups with certain suppliers, but also managing different ways of transportation. So not only air, but also vessel, and building a bit of a buffer within the lead time to ensure that whatever we commit to, we're able to deliver. That's how I hope I respond to your question, Rushi. Brilliant. Thank you for the question, by the way.
Rob, thank you.
Great. Well, I know that we're just a bit over time here, so I suppose in the sense of time, we'll go ahead and wrap up. Thank you so much to Antonia, Federico, Brian, and Nicola for their time today. And this is a really helpful session. And as Nicola mentioned, I think this will be the first of many throughout next year as well. So, whether you're still going to be around as a student next year at LBS or in the context of alumni, please do continue to engage with Therma in the future. I'll pass it to Nicola if she has any closing words.
Thank you, Mustafa, and thank you to the presenters. So for all of you that registered for the event, then I have your details so that we can continue engaging with you and sharing with you updates on Thermofisher. And for those that are on the call today that didn't register, it would be really great, Mustafa, if you could share my email ID with them, just so that I can add them to our tailored communication, which we are separating to whether you are looking for the GLDP program or whether you're interested in opportunities globally across Thermofisher. So I'm still building those channels of communication out. But if you can help me to provide me with those email IDs, that would be perfect. Thank you very much. And thank you very much for your time today.